I'm Kenneth Rogers. I'm a child and adolescent psychiatrist. I've been practicing now for about 30 years in the field. I would consider myself a African American male from the rural South, born and bred in South Carolina, but spent a big chunk of my life moving around the country. And so, from a regional standpoint, I tend to view myself as probably more Southern in terms of you know religion, things that I tend to focus on. I've done a lot of work in the religious space, especially around Christianity and the focus of the church related to mental health issues. So do a lot of speaking engagement with religious organizations to try to really figure out how do you marry um, religion and spirituality and mental health. Mentorship, actually. I remember when I first showed up for medical school, my idea was I was going to go back to my small town of 8,000 people in South Carolina, and I was going to be a primary care doc. And so I had decided that I was going in, was probably going to do a family medicine residency. And the first month that I was there, I met two of my mentors that really kind of changed my life. One was a child psychiatrist, one was a forensic psychiatrist. And they convinced me over the course of the next 3.5 years or so that I really wanted to become a psychiatrist, and not just a psychiatrist, but a child psychiatrist who worked most of his life in the juvenile justice system. And so that's kind of where this all happened. I think had it not been for the two of them, I probably would have taken a very, very different path. I actively involved in three organizations. I've been involved in the APA since I was actually a medical student. And I think that one of the things that really helped me there was being one of the minority fellows at the APA really got me really involved in thinking about organized medicine. Then I really became involved in ACAP during my residency. And ACAP for me has been the organization that has kind of been my steady for the most part. I don't think I've actually missed an annual meeting since I was probably fourth year medical student. So that's been the organization I've found that I've gotten my most, I guess, professional fulfillment, really personal fulfillment from. I was on the council for a number of years. I've been involved in a number of committees, especially around juvenile justice, correctional issues, those kinds of things. And most recently at ACAP being the co-chair of the Black Caucus. And then the other organization that I'm involved in is the American College of Psychiatrists. Um, been doing that now for the past 5 or 6 years, and really enjoy the college, and I think a chance to really collaborate, communicate with colleagues that tend to be a little older, more established in their careers, and I think has really helped me kind of navigate as I've kind of gone along in my career. I think that the thing that probably jumps out at me most is, like I said, most of my work has been in the juvenile justice system. And I think the thing that has jumped out at me is I think about this one case that I had a few years ago. I was working at one of the justice systems in Baltimore, where I stayed for about 10 years. And I was interviewing this young man about traumas in his life. And he told me, no, I've not experienced any traumas, etc. And got to know him over the course of the next several weeks. And turned out that this was a young man who had his brother killed in front of him. Brother died in his arms. But this young man didn't process that death as a trauma. It was kind of a normal state of being, which really made me realize how many kids, depending on where they grow up, sometimes incorporate trauma in a way that it almost becomes normalized versus becoming something that they see as traumatic. Yet it greatly affects their lives, how they live their lives, what they do. And in this particular case, it was the patient, his brother, mother, father, and sister who were outside in their yards, and an SUV comes around the corner, shoots the brother in the front yard. Mistaken identity kind of situation, but you look at many of our communities, what they're going through, the things that many kids are experiencing, and yet there's not adequate mental health services in many of those neighborhoods. Not to mention, of course, the piece that would make the neighborhood safer. And so, my anecdote has really been trying to figure out one, thinking about that situation, but also how do you utilize that to really think about some of those social determinants, and how do you change the social determinants based on working with both organized medicine itself, but also community organization, thinking about how do you get involved with law enforcement? How do you think about working with the churches? That was actually one of the big pushes originally to start working with churches, because there was one that was there that happened to be focused on curbing violence in the neighborhood. And so I think there's a lot that can be done as child psychiatrists, both in the professional space, but also the community engagement and leadership space. It's interesting. I think that psychiatry has become a lot more popular over the past few years for medical students, and certainly for residents. But when I was coming along, one of the things that I think was a deterrent was I always thought about, psychiatrists being these people that wore plaids and flowers together and were a little bit strange, because where I grew up in rural South Carolina, there really weren't a lot of psychiatrists there. As I've gone along in my career, I've met really a lot of very cool and involved people related to mental health, but especially in psychiatry, that happen to be doing some amazing things. And the piece that, like I was talking about earlier, is really our ability to change society, to be able to advocate, because one, we're extremely highly trained individuals. We understand systems by nature of what child psychiatry is and the training that you end up going through. And we also understand the small incremental things that we can do to make a huge impact in people's lives and communities' lives. And so I always encourage medical students to think about psychiatry, at least give it a look. And the thankful thing is, over the past few years, I've been excited that I see more and more bright young people deciding to take the leap to say, you know what, a career in psychiatry actually could be a really, really good thing. And I must say, looking back on my career, I've absolutely loved it and done some things that I probably wouldn't have been able to do otherwise in a lot of other areas of medicine, especially when I think about the broadness of not just my professional life, but personal life as well. I think that rural America, especially in the South, sometimes doesn't get the level of access to services that you would hope for. I think that comes with a number of challenges. My school district that I grew up, actually, of all the school districts in South Carolina, was actually ranked about third from the bottom. So I did not grow up in a great school system, which meant that through college, and even through medical school, there was a lot of catch up just in terms of how do you study, how do you handle large volumes of information, how do you piece things together. And I looked at colleagues who were doing that a lot faster, and I thought that was one challenge I had to overcome. The second piece is I had mentors who really pushed me. Ken, you probably need to leave here, go somewhere else, have a different set of experiences, and then come back, because that will change how you see the world, how you process what you can do, and you understand yourself better as an individual. I think that was actually some of the best advice that I ever got, because as a kid, growing up in a poor family, you don't travel a whole lot, except to go visit families in other places. And so there was a bunch of the country I'd never seen, a bunch of the world that I'd never experienced at that point. And so moving from South Carolina to California was really an eye-opening experience for me in terms of just the possibilities and what people were doing in different places. And then, of course, having moved around a little bit more, Maryland, for example, really helped me to process every place is not like the place I grew up. Here are the things I can learn. Here are the things I can incorporate. make me a better person so that I can actually go back to the place that I came from, and perhaps think about things more broadly and a little bit differently than I would have and I never left. And so I'm really, really grateful for that advice and mentorship very early in my career. I always look at the whole idea of mentorship and sponsorship, and people talk about that a lot these days. But I had some really good mentors in my life who not only guided me through my career, but also helped me make good decisions that I probably wouldn't have known to make on my own. And I think without them, I would have found it difficult at times to know how to navigate some situations that I found myself in. And as I mentioned, the mentors that I had in medical school were the same mentors that I had as a practicing psychiatrist and, a mid-career and even later career psychiatrist. So for example, Harry Wright, who died a couple of years ago, was a mentor of mine. And Harry really taught me a lot about, one, how to choose the right job, how to identify and think about identifying the right bosses, and being able to think about the long game instead of the short game. And I think that is something that's always stuck with me. And then I've had, other mentors that happen to be bosses and stuff that had really succeeded in their careers that opened doors for me, that I wouldn't have even known existed had they not opened them. And I think that has certainly made a huge, huge difference in my career. And the other piece, in all honesty, and people always talk about it all the time, is just hard work. It's tough sometimes to get things done. So you find yourself sometimes working really long hours, being engaged in things that you probably say to yourself, I'd rather not do right now, but you do it for the greater good. And I think that those things kind of coming together has really helped me in my career. The variability and flexibility. The thing I've loved about being a child psychiatrist is throughout my career, I worked in the public sector, I worked in academia, I worked in consulting, I've done work in the insurance industry. I mean, you name it, it's been a really broad career. And then, of course, like I talked about earlier, the community advocacy involved in churches, other organizations, et cetera. I think it's opened so many doors for me that I've been able to kind of move back and forth between things. And so I think the flexibility of what psychiatry does for you is just amazing, especially child, because again, you understand systems, you understand people. And so once you figure out those two things, life becomes, limitless because you can work your way through just about any situation. Was that a serious question? It's challenging at times being a minority. And I think the thing I think about sometimes is how I've overcome some of those things. Sometimes by mistake, sometimes just by being, a caring person. I remember one of the first patients I saw in my residency was a 50-ish-year-old Caucasian woman who came out and said to the receptionist as I'm standing there, I don't want to see no blankety blank N-word psychiatrist. And I was kind of taken aback for a second. And then I became curious because that's the other thing that I've learned about psychiatry is rather than looking at things at face value, it's just become curious about why the reaction's there. And so I started seeing this lady as a second year resident, my first couple of weeks on outpatient psychiatry. I ended up seeing her for the next 7 years. And over the course of 7 years, I understood a lot of the underlying dynamics that were going on at the front desk that day. She'd been previously sexually assaulted. result of a gang rape, number of African American individuals. And so working through that trauma really taught me a lot about how trauma affects other people. And so that was my first introduction there. But I think the other piece that I've noticed is that as I've gone further up in administrative roles and in academia, you find that the same things that are struggles when you are a medical student or a resident sometimes continue to be a struggle at the same time. There are also the slights that come at times. People question, why are you sitting in the room? Oftentimes you may be the only person sitting in that room, depending on where you are, and trying to figure out, how do you keep your cool? How do you not let other people's ideas about who and what you are affect you as an individual, and affect the job that you do? And so, yeah, I mean, racism exists in America. Sexism exists in America. I mean, you name it, all the isms are there. My goal has largely been, how do you help people to try to see you as an individual? And sometimes you're able to get people there. Sometimes you're not. But I think it's just one of those challenges that we have to be honest and accept that, it's there. I was always a good kid in science. I mean, I always loved science, always loved math. I'm the youngest of seven kids. Five of my sisters are teachers, and two of them are math and science teachers. And so, as a kid growing up, one of the things that they were real big on is, if you don't understand anything else, you're going to understand math and science. I went in a totally opposite direction. My major going into college was music education. And my goal was to become a high school band director. That was what I had my mind set on. And somewhere about halfway through college, that began to change as I looked at career paths on both sides and what my life was going to look like in one versus the other, and decided to switch. I think the positive thing is having those early experiences in the sciences and in math really kind of prepared me for where I decided to go in college, because it wasn't a huge leap for me. Once, I was second semester sophomore, I decided to change my major. So I think that underlying piece was there. The other piece that I think really kind of set me up is I grew up in church. My dad was a deacon in the church. And so one of the things that the deacon was responsible for was going and visiting the sick. And so I found myself in lots of nursing homes and lots of homes with sick individuals throughout my childhood, for as far back as I can remember, because I used to always make those visits with him. And what jumped out at me was not necessarily the suffering that existed, but the coping skills that I saw a lot of people exhibiting, even in their circumstances. People that were terminally ill, you still saw a lot of faith and hope and smiles. And it created a curiosity of, what's driving that, and that desire to understand people. I think it is a huge chunk of what made me go toward psychiatry. That's a good question. I think about where I trained time wise and where we are now and where I see us heading. So when I trained, my focus was not pharmacology at all. Yeah, there were drugs that existed, but I was trained in psychodynamic psychotherapy. That was kind of where I lived my life, is kind of still how I think about things. And so over time, we've moved from psychiatry being a very therapy-based specialty to becoming a much more biologically based specialty. And as I'm working with, medical students and residents now, I continue to be amazed by what I'm learning from them versus what I'm teaching. I'm seeing a lot more of the neuroscience folks that are coming into psychiatry. I'm seeing people that would have previously gone into neurology that are now coming into psychiatry. And so I think that that biological basis, while there are some things that we've lost, there are other things that we've gained. And I think the understanding of the mind and also the brain has brought us to a very, very different place. I see the advent of technology now, especially as I look at, telemedicine, I look at, phone apps. And I think that where I see us going more in the future is really becoming much more technologically based. How do we move to more artificial intelligence, doing some of the things that I've traditionally done? I think that there's a lot of depression, especially minor and maybe more intermediate levels of depression, that will probably be treated differently in the future than it has been so far. And I think that what we'll start to see is more bachelor's level folks that are going to be entering the field that will be doing some of the stuff that we don't necessarily have to do. Really, anybody could do it. It's well trained. And I've seen, even hired some folks that were, undergrads in psychology that are much more adept at calling patients, doing follow-ups, making sure people are okay. So there really becomes more of a team-based care versus kind of an individual doctor-based care, which means that that team could see a lot more individuals. So I see that beginning to happen. I think my concern that I have for the future is where will we end up in technology? What will change as we see more telemedicine? As a society, do we find ourselves disconnecting more because of the ability to do Zoom, for example, because of our ability to have an app that helps us? And so that's the piece that I kind of worry about a little bit for the profession. But I think that right now we're on a trend, and I don't know where it will end up. In all honesty, I think there's some good things about it because we're able to reach more people. This morning, I've had conversations, treatment sessions with folks in 3 different states this morning, and I could have never done that if I were sitting in an office and waiting for people to come in and show up. So I've got kids that go off to college. I'm still able to see them wherever they are around the country. And so I think that technology has helped us quite a bit. But it still remains to be known what the benefits are and what the downsides are. I think it's a great career. If anybody would have told me when I was signing up that being a child psychiatrist could be as wonderful as it is, it has been, I'd have probably said, "No, you're kidding me." But I am actually paid to enjoy spending time with kids and families, and watching the change occur, to me is just priceless. I'll leave you with one anecdote that we were talking about earlier. There was a young man that I remember seeing, and he came into my office with his high school football coach, great football player, and had a lot of unique family situations, some neglect issues, etc., and was living with the coach. And the coach recognized the anger that this kid had and wanted to get him into treatment. So I began seeing this young man around 10th grade, saw him for about 2 years, and then kind of dropped off the radar screen. He'd gotten better. And one day I'm in my office, it's probably about 7 years later. And this guy comes in, and he's dressed well, extremely well-spoken, just the epitome of what somebody would want to see in their kid. He comes in, he says, "You don't remember me, do you?" And I said, "I don't. Refresh my memory." He didn't tell me his name, but he just went through, "You saw me with my football coach," and the lights came on. And what had happened to this young man is he graduated from high school because his grades were terrible at the time I saw him. So the question was he going to graduate? He went to a junior college to play football. While he was there, he decided, I'm not playing football anymore. He had actually got a scholarship to a Division I school and decided to turn it down, but went academically to the same school. Had actually graduated, was actually working in a professional role, was in a relationship that he said was going well, had repaired some of the relationships that were going on with his family, and was in a very, very different place. And the thing he said is, I just wanted to come back to let you know that the time I spent with you changed my life. And when you get that kind of experience, it locks you in because now I'm committed to saying, you know what, if I've changed one life, I can change other lives and I can continue doing what I'm doing to try to make a difference. And so I think that child psychiatry has allowed me to make a difference, both on an individual level, but I think also on a much larger systems level. And so for me, I'm just, committed to doing that. And I see child psychiatry as the path to making that happen.